Welcome to the Maternity Mentor. Today we will be talking about postpartum hemorrhage and the symptoms to look out for that could save your life. Stay with us. Hi, I'm Samantha. I've been a registered nurse since 2009, working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC, a maternal newborn nursing certified, and I have received training in perinatal mood and anxiety disorders, as well as perinatal bereavement. Postpartum hemorrhage is a very serious complication after birth that, if left untreated, can lead to death. Let's explore what causes a postpartum hemorrhage and the treatments used for it. Postpartum hemorrhage is heavy bleeding after giving birth. It's sometimes called PPH. Postpartum hemorrhage is a serious and potentially life-threatening condition. Approximately 1 to 5% of women will experience a postpartum hemorrhage, making it very rare. Postpartum hemorrhage can happen up to 12 weeks after giving birth, but the majority of postpartum hemorrhages will occur within the 24 hours after delivery of your baby. Bleeding is normal after both a vaginal and cesarean birth, but postpartum hemorrhage is heavy bleeding beyond what is considered normal. Postpartum hemorrhage is diagnosed through a variety of methods, including measuring the amount of blood loss during delivery, a mother's symptoms, and blood tests. After the delivery of your baby and the delivery of your placenta, your uterus starts the process of contracting back down to its pre-delivery size. The contractions apply pressure to the blood vessels that were attached to the placenta to decrease their bleeding. If the uterus does not effectively contract, these vessels will bleed freely, causing excess blood loss leading to hemorrhage. The most common cause of the uterus not effectively contracting is when small pieces of your placenta remain attached to the uterine wall, leading to hemorrhage. Other causes of postpartum hemorrhage can include a tear in a blood vessel in the uterus, a vaginal tear, a cervical tear, a uterine rupture or inversion, a hematoma, which is bleeding in a hidden area in the pelvis, most commonly in the vagina or vulva, placenta problems, and blood clotting disorders. Unfortunately, some women are more at risk for a postpartum hemorrhage due to conditions or factors they may have. These risk factors include an enlarged or over-distended uterus, which can be caused by having too much fluid or a large baby, placental placement issues like placenta previa, where the placenta grows over the opening of the cervix, placental abruption, where the placenta detaches from the uterine wall unexpectedly, having high blood pressure or preeclampsia, having a multiples pregnancy like twins or triplets, obesity, using medications to assist labor or to stop labor, having a cesarean section, having general anesthesia, infection, having a prolonged labor, having a precipitous labor or very quick labor, multiparity or having many previous births, having an assisted delivery using vacuum assistance or forceps, and being of Asian or Hispanic descent. Before we continue, please remember to hit the like button and subscribe so you can get our latest content to have a happy and healthy family. Now let's talk about the symptoms of postpartum hemorrhage. It's very important to know the symptoms of postpartum hemorrhage so you can contact your doctor if you think you may be experiencing one. One of the most important symptoms of postpartum hemorrhage is decreased blood pressure and signs of shock. Symptoms of decreased blood pressure and shock include blurry vision, dizziness, belly pain, having chills, having cold, clammy skin, feeling sleepy or weak, increased heart rate or feeling like your heart is racing, confusion, and feeling like you're going to faint. Other symptoms of postpartum hemorrhage can include uncontrolled heavy bleeding that doesn't stop or slow down with or without clots, swelling or pain in or around the vagina and perineum, which is the skin between the vagina and anus, pale skin, and nausea or throwing up. If you think your bleeding is too heavy and you're having any of these symptoms, you should call 911 or go to the nearest emergency room. If you are not having symptoms and you're not sure if your bleeding is heavy, go to the bathroom and change your pad. Set a timer for 30 minutes and then go back to the bathroom to check your pad. If your pad is saturated, meaning at least half of the pad or more is full of blood, this could mean that you are bleeding too much and you need to call your healthcare provider right away. As always, if you have any questions, call your healthcare provider. That's what they're there for. The goal of treatment in postpartum hemorrhage is to stop the bleeding. To do this, your healthcare provider will examine you to try and determine the cause of the hemorrhage. If you have retained pieces of placenta, they will remove them. If you have a vaginal or cervical tear, they will repair the tear with stitches. Your healthcare provider may massage your uterus to attempt to stimulate uterine contractions. They may also give you medications to induce uterine contractions. These medications may be given in your IV, as an oral pill, or as an intramuscular shot, or as a rectal medication. Your healthcare provider may also place sterile gauze or packing inside your vagina to help with the bleeding. Finally, they may insert a Bakri balloon, which is a soft catheter threaded up through your cervix. Once in place, the balloon is inflated with saline to provide pressure on the blood vessels. The Bakri balloon is usually left in place for 24 hours. More invasive treatments of postpartum hemorrhage can include laparotomy, which is where your doctor will perform a surgery to determine where you are bleeding inside. When they find the bleeding vessels, they will tie them off using special coils or glue. Finally, if your bleeding is too heavy or if your life is in danger, your doctor may opt to perform a hysterectomy, which is where they remove your uterus. This is rare and usually only performed to save a woman's life. After your postpartum hemorrhage, you will receive fluids and oxygen to help you recover. If the hemorrhage was large, your doctor may want you to receive a blood transfusion to help replace the blood you lost. They may also place you on an iron replacement supplements to help your body recover because hemorrhages often leave you anemic. Postpartum hemorrhage is a serious condition where women experience heavy bleeding after the delivery of their baby. I hope this has explained what postpartum hemorrhage is and the symptoms you should look out for so you can receive the treatment you need quickly. Please share your comments and let us know what topics you would like to hear more about. If you like this content, please remember to hit that like button and subscribe so you can be the first to receive this information. Remember to share this channel with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.